A patient was brought to the clinic by his friends, saying that they have drank excess alcohol on the previous night, and patient suddenly woke up at the mid morning, that is around 2 a.m., saying that he is suffering with severe headache and there is a retroorbital pain, like someone has stabbed his eye with a sharp object. Actually, it was not a stabbing, but the patient is saying that someone has just stabbed his eye with a sharp object, and there is a congestion on the single side of the eye, and there was a running nose present, and there was a drooping of the saliva also present. Mm, Upon examination, we found that the patient is suffering with a trigeminal autonomic cephalgia. Trigeminal autonomic cephalgia is a condition where, as the name indicates, cephalgia means there is a headache, and trigeminal means the cranial number fifth is affected. We know that the cranial number five has three branches like this: V1, V2, V3. So as in this the in this the trigeminal crane number 5, V1 is severely affected, that is the ophthalmic branch. So the patient complains there is a retroorbital pain, that is like someone has just stabbed his eye with a very sharp object pain. um, so and there is a autonomic functions also, like there is a increase in the parasympathetic activity. That's why patient is having a severe turning nose, congestion in the eye, and tearing in the eyes. All these are secretions which has a which exaggerated due to the activity of the parasympathetic system. So this is a condition of the trigeminal autonomic cephalgia, and we have to differentiate this with trigeminal neuralgia. Trigeminal neuralgia is a condition where the trigeminal nerve is affected, V1, V2, V3. The These are the branches of the trigeminal. In this condition, any branch of this trigeminal can be affected, like V1, V2, and V3. In this, there is no autonomic dysfunction. There is there is only pain. The pain is severe, and there is no dysfunction of the autonomic system. There is no secretion of the saliva, no secretion of the tears from the eyes, etc. Now comes the treatment for the trigeminal autonomic cephalgia. For the acute case, like the patient has acutely came to you, then give the oxygen for about 30 to 40 minutes. We have to give oxygen mask. We have to give 100% oxygen concentration for about 30 to 40 minutes, and then add the drugs like triptans. The drugs which ends with the triptan, example sumatriptan, they are the 5H1B1D acting agonist. And then for the prophylaxis, like to uh, to 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 prevent this condition happening again and again, we have to give the prophylaxis, and the drugs includes the verapamil. These are the calcium channel blockers. We know calcium channel blockers are two types: DHP and non DHP. This verapamil comes under the non DHP type.